Alrighty, welcome back, everyone. This is Field Notes with Mike. I'm going to be covering Chapter 5 today out of our class lecture notes, and this all comes from our Emergency Care 14th edition textbook. I am an EMT student currently working on my EMT up in Northwest Florida, and I'm designing these videos so I can have something to listen to on my way to class, on my way home from class, before I go to bed, after I read the chapters, like getting in and just listening to the same stuff. And especially with the highlighted parts, these lecture notes are going to be, some of them have highlighted words, and I'll mention that. So let's go ahead and hop into Chapter 5, Medical Terminology. Section 1, what is medical terminology? Medicine has its own language. As an EMT, we communicate with nurses, physicians, and other providers using precise medical language. Medical terminology allows us to describe what we see, where it is, and what's happening without confusion. Those three things are highlighted: what we see, where it is, and what's happening. Section 2, components of medical terms, compound words. Some medical words are compound words, meaning they're made up of two or more complete words. An example would be smallpox. So you have small and then you have pox. Word parts, most medical terms are built from word parts, such as roots, prefixes, and suffixes. How I remember that was like the root being the foundation, meaning it comes before, and then suffixes, it goes on the end. So that's how I saw that out on practice tests on Quizlet. Roots are the foundation of a word and usually describe a body part or system. For example, therm means heat. Combining forms, roots are often used with a combining vowel, such as the letter O. Therm plus meter becomes thermometer, an instrument for measuring heat. Moving into prefixes, prefixes modify the meaning of a root. DYS means painful or difficult, like dyspnea, DYSPNEA. The DYS is up in front because it's a prefix. The suffixes usually describe the conditions or processes, such as itis, meaning inflammation. So you have arthritis, artho, arth, and then the ITIS is at the very end. So that being a suffix. Section 3, dissecting a medical term. Let's break down the word. What is this? Something citus. Chlo means bile. Cis means sac. Itis means inflammation. When combined, cholestasis means inflammation of the gallbladder, an organ that stores bile. Abbreviations and acronyms. Medical professionals commonly use abbreviations and acronyms. An acronym is an abbreviation that can be spoken as a word, such as CPAP, continuous positive air pressure. When to use medical terminology. Medical terminology should not be used when speaking to patients or family members. I saw that on a Quizlet. Even among professionals, complex language can cause confusion. When there's a chance of misunderstanding, just use simple language. It's better that way and it's accepted. Section 6, anatomy and physiology. Anatomy is a study of body structure. Physiology is a study of how the body functions. Understanding both helps EMTs know what's happening inside the body during illness or injury. Anatomic position, section 7. All directional terms are based on anatomical position. The patient is facing forward, arms at the sides, and palms facing forward. That is anatomic position. The left and the right always refer to the patient's left and right, not yours. Directional terms. You have midline. The midline divides the body into left and right halves. Medial means closer to the midline, and lateral means farther from the midline. Anterior and posterior. Anterior, or ventra, refers to the front of the body, And anterior or ventra refers to the front of the body. Posterior or dorsal refers to the back. Posterior or dorsal refers to the back. Superior and inferior. Superior means above, inferior means below. Pretty forgot that. Proximal and distal. Proximal means closer to the torso, and distal means further away, like checking a distal pulse. Palmar and plantar. Palmar refers to the palm of the hand, and plantar refers to the sole of the foot. Whenever I think about plantar, I think about people that have flat feet. I think it's plantar or something. So when I saw that on a Quizlet, on a test, I was like, that's the foot. And it is. So that's in my memory now. Body lines and quadrants. The chest is divided using the mid-clavicle and mid-axillary lines. The abdomen is divided into 4 quadrants: right upper quadrant, left upper quadrant, right lower quadrant, left lower quadrant. These terms help EMTs describe pain and injury accurately. Positional terms. Supine means laying on your back. Prone means laying on the abdomen. The recovery position, also called the lateral recumbent, is preferred for unconscious, non-trauma patients. The Fowler position means seated upright. Semi-Fowler means partially reclined. Fowler, semi-Fowler, recovery, prone, supine. Supine being laying on your back, prone laying on your stomach. Recovery position on someone's side, left or the right side, is preferred. You do this for unconscious, non-trauma patients. Fowler is seated upright, and semi-Fowler means partially reclined. Section 11, chapter review. That's it. It seems like a lot more in the book, and there's a couple things that a couple words that I saw on practice tests that I'm going to bring up that I haven't seen here. We'll talk about that here in a second. Chapter review. Medical terminology is the language of healthcare. Roots, prefixes, and suffixes give clues to the meaning. Anatomy and physiology help EMTs understand what's happening inside the body. Accurate terminology leads to clear communication and better patient care. This wraps up chapter 5. There's a couple words that I saw in Quizlet that I didn't know the name of. MELAN with a dash and then O. That means black. Pathy, PATHY, is disease. HEPAT, that's the liver. To make plural, you add an I. Vomiting, I saw that come up on a couple Quizlets, and that is EMISIS. And discharge is RRHEA. We haven't gotten there. We just got out of chapter 2, so this is chapter 5 in class. I'm not sure what he's going to mark for us that is something that we have to know or that's going to be on the test. But I feel like there's a lot of information here, and these slides really didn't cover that much. There's a lot more in the chapter to read and to go over. Looking at the workbook right now, I see a lot more terms. But yeah, I'm not going to drag this out. Thanks for listening. Stay tuned for chapter 6, and just subscribe so you know when the next video is. I hope this helps. Thanks.